Hi, Mrs. George. I'm Peter, one of the practice nurses at the health center. I'm going to talk to you today about some lifestyle changes that you can make to improve your heart health.
My doctor told me that I have high blood pressure. I don't want to have problems with my heart. Now I'm worried because my father had a heart attack when he was 64.
I can imagine it was a shock to hear that you have high blood pressure. But fortunately, there are a lot of things that you can do to lower your blood pressure and prevent heart problems.
That's very reassuring to hear. What sort of things are you talking about?
I'll explain about some lifestyle changes you can make. If you make the changes, you may reduce your blood pressure and not need to take medication.
That sounds good. What sort of changes do I have to make?
The first thing to think about is modifying your diet. Try not to eat saturated fats like fatty meat, cheese, and butter. They increase the levels of bad cholesterol in your blood. It's better to eat oily fish and nuts instead.
All right. Is there anything else I shouldn't eat?
It's very important to cut down on salt in your diet. Salt helps your body hold onto water. That puts more pressure on the walls of your blood vessels, which sends your blood pressure up.
Oh, I didn't know that. I'll watch my salt intake from now on.
Getting some regular exercise each day will help you to keep a healthy weight. Any activity that increases your heart rate is best, for instance walking at a brisk pace, dancing or swimming. Do you do any exercise at the moment?
I don't do any regular exercise. I go for a walk occasionally, but that's all.
That's a good start. Many people find it is easier to get into a regular routine by going for a short walk every day and slowly increasing the distance every week. You could also walk slowly at first and gradually increase your walking speed. How does that sound?
I think I could manage that.
Another lifestyle change is quitting smoking. Can I ask if you smoke at all?
Yes, but I don't smoke much. Usually around 5 cigarettes a day.
Well, smoking is one of the main risk factors for heart disease. How would you feel about going on a smoking cessation program?
It might be helpful. I've tried to give up on my own a few times before, but it never worked. I always end up smoking again.
The program helps a lot. You'll be given advice on strategies to stop smoking. You can also try nicotine patches or nicotine gum to help with cravings while you stop smoking.
Okay, I'm willing to try that.
It's also important to cut down on alcohol intake. Do you drink alcohol at all?
I don't drink alcohol. I usually have carbonated drinks or juice instead.
Carbonated water or plain water are both fine. Just be careful with sugary, carbonated drinks or juices, as they can increase your risk of diabetes. Diabetes is another risk factor for heart disease.
I see. Okay, I'll change to plain water from now on. Is there anything else I should do?
The last thing is to check your blood pressure regularly. You can do this yourself at home, or come into the health center and we will check it for you. Your blood pressure should be between 90/60 and 120/80. If it is more than that, you must see the doctor immediately.
Right. I'll do that.